What else prevents UTIs after sex? Imagine this. You just finished a lovely moment, and now you want to do everything possible to keep your urinary tract healthy. While urinating after sex is a well-known step, there are other effective ways to reduce your risk of developing a urinary tract infection. These methods are backed by medical guidelines and focus on maintaining good bladder health, which is important for overall well-being and not directly linked to bladder cancer risk. First, good hygiene is key. Wiping from front to back after using the toilet helps prevent bacteria from the anal area from reaching the urethra. Keeping the genital area clean is important, but avoid harsh soaps or douches, as they can upset the natural balance of bacteria and defenses. Drinking plenty of fluids throughout the day is also helpful. Aim for at least 1.5 liters of water daily. Staying well hydrated helps flush bacteria out of the urinary system by promoting frequent urination, which can prevent bacteria from settling and causing an infection. Your sexual practices and contraceptive choices can influence UTI risk too. Using spermicides, especially with diaphragms, might increase the chance of UTIs because they can alter the normal bacteria balance in the genital area. If you experience recurrent UTIs, talking with your healthcare provider about alternative birth control options can be beneficial. Also, it's wise to avoid sexual activity during an active infection to prevent further irritation and allow your tissues to heal. For those who get UTIs often after sex, medical options are available. Taking a single dose of antibiotics within 2 hours after intercourse, called postcoital antibiotic prophylaxis, has been shown to significantly lower the chances of infection. This approach is usually recommended for people with frequent UTIs linked to sexual activity and should always be done under medical supervision to avoid antibiotic resistance. Common antibiotics used include trimethoprim sulfamethoxazole, nitrofurantoin, and cephalexin. Remember, this isn't a routine for everyone and should be personalized by your doctor. Some people consider cranberry products like supplements or juice for prevention. While there is some scientific basis suggesting cranberry compounds may help prevent bacteria from sticking to the bladder wall, evidence is mixed. If you choose to try cranberry products, concentrated supplements are often better than juice, which can be high in sugar. Always discuss with your healthcare provider before adding supplements to your routine. Maintaining bladder health is also important for overall urinary system function. While UTIs are not directly linked to bladder cancer, chronic bladder inflammation might contribute to long-term issues. However, current research shows that occasional or recurrent UTIs do not significantly increase bladder cancer risk. The main preventable risk factors for bladder cancer include smoking and exposure to certain industrial chemicals, not UTIs. In practical terms, most people can lower their risk by staying hydrated, practicing good hygiene, urinating before and after sex, and discussing contraceptive options with a healthcare provider. If UTIs keep coming back, it's important to seek medical advice for personalized prevention strategies. Always consult a healthcare professional if symptoms persist or worsen, as early treatment helps prevent complications. In summary, combining simple lifestyle habits like drinking enough water, maintaining proper hygiene, and working with your doctor on preventive measures can make a big difference. These steps support bladder health and reduce the chances of UTIs after sex. Remember, individual needs vary, so personalized medical guidance is always the best route to keeping your urinary tract healthy and happy.